Go now. Are you ready now? Let me go. Show them. Show them. Mr. Flavor.
Hello, welcome to Anatomy Made Easy. In this voice note and in this video, we're going to be talking about the gluteus muscle. The gluteus muscle. Of course, you know the gluteus muscle is the muscle that is on your buttocks. There are three of them. Gluteus maximus, that is the big one. Gluteus medius, that is the middle one. And the gluteus minimus, the small inner one. Now, let's start with the gluteus maximus, the outer one that you can see. It originates from three places: the posterior ilium, the dorsal surface of sacrum and coccyx, and the sacrotuberous ligament. These are the origin. Then it goes on to insert at the iliotibial tract, and also the gluteal tuberosity of the femur. I said gluteus maximus has three places where it originates from: posterior ilium, dorsal surface of sacrum and coccyx, and the sacrotuberous ligament. Then it goes on to insert at the iliotibial tract and gluteal tuberosity of the femur. What does it do? It is the powerful hip extensor. It extends the hip. Then it can also laterally rotate your thigh. And when you want to sit up, that is the muscle that helps you to sit up and also for you to climb the staircase. It is supplied by the inferior gluteal nerve, L5 to S2. While the blood supply is the inferior gluteal artery. Of course, you know that this muscle is important because IM injections are given at the upper outer quadrant of this muscle. Now, let's look at gluteus medius and minimus. They are inside or behind the gluteus maximus. Where are they coming from? They originate from the external surface of the ilium. Then they go to insert into the greater trochanter of the femur. What they do is to abduct the hip, ABD. They abduct the hip. Remember, the maximus will extend the hip, medius and minimus will abduct the hip. They also stabilize your pelvis, especially when you're walking. They are supplied by the superior gluteal nerve, but the maximus is supplied by inferior gluteal nerve. So, the superior gluteal nerve, L4 to S1, supplies the gluteus medius and minimus, while the superior gluteal artery also supplies them with blood. Unlike gluteus maximus that is supplied by inferior gluteal nerve and inferior gluteal artery. Of course, you know that when you give your IM injection, it will pass through the gluteus maximus, given on the gluteus medius. And also, if there is an injury to the medius and minimus, you have the Trendelenburg gait. Trendelenburg gait. I'm going to send a picture to show you. In fact, this is the Trendelenburg gait. Yes, because when these muscles are weak, the pelvis will tilt, like it will not be aligned when you're walking. So that is it for the gluteus. We have three, remember: maximus, medius, and minimus. I'm still Ekechukwu Dora of Anatomy Made Easy. Thank you for listening.